Welcome back to Talk of the Town. We turn our discussion next to the important and interesting topic of anaplastology. This is the branch of medicine that works with dealing with restoring a missing or malformed part of our body through the use of prosthetics. And with me, I have Gregory Gion. He's with Medical Art Prosthetics. Thanks for coming in today, Greg.
You bet, Janet.
And Greg
Thanks.
is an anaplastologist.
That's right.
That is quite a word.
Yeah.
So today we're talking about nasal prosthetics.
Mm-hmm.
All right, and you've brought some samples along.
Right.
Let's take a look at them. What are they
Okay.
made of?
Most prostheses, I'd say about 95% of the nasal prosthetics that I make are silicone.
Okay.
Silicone rubber. So it's a soft, flexible material. And so this is just an example so people get a quick feel for what this actually is. It's not a surgical replacement. It's actually a prosthesis that goes on each day and is taken off and cleaned.
Okay, and how is it attaching there?
In this particular case, I've put a magnet in here just to make the model stay in place. But there's basically like three main methods of attaching a prosthesis, and I've got some photographs.
Great.
We'll bring these up and kind of, I'll move rather quickly through these but they do illustrate the basic methods. So maybe the most common method is still adhesive, where someone would just apply an adhesive to the back of their prosthesis and then put it in place.
So now it's in place.
Now
here.
it's in place,
Okay.
and you can get an idea of what that would look like.
And that's something that you would put on and off every day with that adhesive.
Exactly, and then they'd clean the adhesive off and reapply it each day. Another method is some of our patients have osseointegrated implants placed into the bone inside the nasal aperture, and this allows them to attach their prosthesis magnetically without having to rely on adhesive.
Isn't that
So
amazing?
the back of the prosthesis shows the 4 magnets that correspond to the implants.
Okay.
It's a really beautiful way to if you're going to wear a prosthesis for your life, it's a wonderful way to be able to do it.
Very quick and easy.
Exactly. Lifestyle is much easier.
And there's the finished
Result there.
Okay.
The final basic method is, which I really enjoy doing, doesn't require any surgery, and it doesn't require adhesive. What we call an intermediate or a retentive piece is designed to fit into the cavity with a magnet in it, so that after, actually you can see the 2 components here, the retentive piece and then the prosthesis itself, and those will click together.
Sure.
So that once the person puts their prosthesis on, they have a nice retentive prosthesis and they don't need adhesive.
Boy, a picture's worth a million words here.
Yeah, they are, and this is just actually another example of the same kind of an approach, slightly different design of the 2 pieces. But again, you get the same kind of result. Mm-hmm.
Really amazing. What are some of the reasons that folks might need one of these?
The main reason, I'd say in my practice, probably is close to 75–90% of the practice is cancer. You know, people have had some sort of a basal cell or squamous cell carcinoma, and they've had their tissue removed, part or all of their nose. Another reason would be car accidents, any kind of a motor vehicle accident or trauma. Gunshots, dog bites, there's a lot of different things that can happen, or even substance abuse.
Sure. I'm actually familiar with someone that does have the cancer situation.
Mm-hmm.
So thank goodness you're here doing this. This is life-changing for folks. Do you ever encounter someone that has their original, I guess, God-given nose, but maybe they're hoping to improve the appearance, maybe due to an injury, like a dog bite or something?
Yeah, exactly. There are folks that have been in accidents, have had plastic surgery, things didn't turn out as well as they'd like, and they're trying to cope with the way their nose looks. They have their nose, but there's something about it that they want to cover or improve. And a prosthesis can address some of those things. But then again, they're wearing a prosthesis each day. So in a case like this, I don't know if you can still see this or not.
Sure, just in our last few seconds here, let's take a quick look.
Yeah, and it's just an overlay prosthesis. So it's really not
the full thing.
a full prosthesis, but it allows the person to see what their nose would look like if they wanted to wear a prosthesis each day.
Oh, I see.
And then very quickly, I've developed a kind of an application material that can smooth and conceal some scars.
Okay.
things like that.
And again, a daily application kind of a
Uh-huh.
Okay. All right. We are out of time, Greg. This is
Yeah.
really interesting, fascinating, and important work. Thank you for sharing that with us
Thank you.
today. We'll be right back with more Talk of the Town right after this.